You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's barknwag.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Saving lives by selling collars, scrunchies, and swag. Please check out Bark and Wag's website, barkandwag.com. That's barknwag.com to see the awesome merchandise. Bark and Wag collars and leashes, collar covers, and decorative bandanas are perfect for your pooch. For the owner of the house, we have t-shirts, sweatshirts, long sleeve shirts, hats, and even coasters. We are expanding monthly, so be sure to check back. We love pooch ideas for podcasts and merchandise too, so send an email to polly@barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Millie Armstrong, owner of Petty Brook Veterinarian Clinic in Vermont. Welcome, Millie.
Hi, thank you.
Well, thank you for coming back to the podcast. I wanted to talk to you. We had a listener ask about what supplements to give your puppy, and then I wanted to have you back to ask what supplements do you give your older dog. So thank you for being back on, and I'll let you take it away.
Oh, thank you. Thanks for having me. And that's always a good question, too, because dogs' nutritional needs change as they get older, and there's always some debate as to, when will dogs' needs change? Is it at 5, 7, 9, 10 years of age? Depends, because different breeds age differently. So the large breed dogs tend to age more quickly, and their nutritional requirements may change as they're 5 or 7 years old. The smaller breed dogs, like the Shih Tzus, the Lhasas, the Poms, they may age a little more slowly, so it may not be till 9, 10, 11 that they need to consider changes in their diet. And as far as supplements go, well, let me back up. In terms of their food, I think as long as they're on a good quality nutritional diet or nutritionally balanced diet, I don't know that there are necessarily a lot of supplements you need to give. But as they age, there may be some things you want to consider talking with your veterinarian about to see if they would benefit from the supplements. And in the United States, I was reading that up to a third of the dogs are given some form of a dietary supplement, which I thought was kind of interesting. They tend to fall into 4 different categories: joint supplements, fish oils, antioxidants, and probiotics. So I'm going to try to just touch on each of those briefly. The joint supplements, the big popular one that we all hear about is glucosamine, and that's a product that's found naturally in the fluids within the joints. So joints that have a lot of fluid would benefit from those supplements. The knees, the hips, the elbows, and the shoulders benefit well from joint supplements. The spine has no joint fluid, so for back issues, it's not really beneficial for dogs with back pain. But the glucosamines help keep cartilage healthy within the joints so that it maintains a nice fluid motion to the joints, so it's less uncomfortable when they get up, when they stand, when they move. And coincidentally, activity helps produce joint fluid, so you want to keep these dogs active and mobile and lots of exercise to help their joints. But different joint supplements behave differently in different breeds. And just like people, what do you take for a headache? Some people might take Advil, somebody takes Excedrin, somebody takes Tylenol. Well, there are different classes and products that contain glucosamines and other joint supplements, MSM and the avocado supplements. And so one dog might respond to one type of medication, and another one might respond to a different type. So this is where you'd want to talk to your veterinarian and see if there's a particular one that they would recommend to try. Fish oil. Fish oils are something that we use a lot. They contain omega fatty acids, and they're pretty much involved with a lot of different systems within the body. So the skin, the kidney function, heart function, even brain health and any other inflammatory diseases going on within the liver are really benefited from fish oils. The big takeaway on this, though, is that the human fish oils are formulated at a different ratio than the pet fish oils. So I know the costs are a little steep for the fish oil supplements, and it's tempting to try a human product and give that to your dog and think that you're giving a fish oil. Why isn't he getting better? Why isn't it working? Because it's not formulated at the same ratio. Dogs, we know, need a higher ratio of the omega fatty acids than what humans use. So be very careful. Again, talk to your veterinarian, see if there's a way you can do the math and figure out what level your dog would need. Antioxidants, we use these to help reduce inflammation and prolong the effects of aging, such as memory loss and cognitive dysfunction. Maybe I need some. Anyway, we find that a lot in some of the different vitamins like vitamin C and vitamin E. I know a lot of people want to give their dogs vitamin C supplements alone, but be careful because too much of that could be a bad thing. So that's another point to remember, to talk to your veterinarian, get the right dosage. Please don't feel like you have to go out there on your own. Most vets are willing to work with you as long as we are being smart about it and safe about it. If you do happen to have your dog on a supplement, please also inform your veterinarian of that, because a lot of these supplements may interfere with some of our medications that we want to use, or they may actually inadvertently be causing an unintended consequence and causing an illness somewhere down the road. So please be upfront. There's no reason to be embarrassed about it, no reason to hide it. We can't help you if we don't know what we're dealing with. So let us know if they're on something. And the fourth topic, probiotics, they're a supplement that we use. They're a natural product that is present in the body to help the live bacteria and the yeast digest our food. And if we digest better, it makes our intestinal tract work more efficiently. There's less inflammation within the intestinal tract. Our nutrients are absorbed better and properly. So probiotics are out there in many different forms, and I think each veterinarian has their own little formulation that they like to use. Purina makes a really good product, and these are available for both dogs and cats. So I like supplements. I think they have their place. I think we just want to be very wise about what we're choosing. Make sure we try to pick medications that are labeled for use in animals and for the species. A lot of people will try to use horse supplements in dogs, and of course dosing is a nightmare when you try to go from one species to the other, so overdoses are possible. Some products that are approved for uses in dogs are quite detrimental in cats, so unless it says specifically safe to use in cats, I wouldn't use it. And the other thing, you're hearing a lot about CBD oil. That's a whole other topic. CBD oil has not been researched in pets, and just because it's sold in stores does not mean it's safe for pets. So be very careful about that. I just feel like when in doubt, check it out. Talk to your veterinarian, and let's just really have a conversation about what will be best, because every pet is different, and we want to tailor our treatments to that pet, not some broad-based article on the internet.
Great. Well, that's a little recap on each of the different, or what's available, and then definitely talk to your local vet to find out what's best for your pet. Especially with the medication, that's a big one, because Chuck the Pug is on many drugs right now, and so we've had to cut on a few things just because it might interact. Good to know. Well, thank you very much for being on the podcast, and we look forward to having you back.
Well, thank you very much, Polly.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.